The last in the series of interpretation of an ECG is ischemia or infarctions. We've covered rate, rhythm, axis, and hypertrophy. Infarction is the extreme of ischemia. So in an ECG, you can find out about ongoing angina, as we call it clinically. That means ischemia of the heart, and likewise infarction as well. The waves to look out for are the T waves and the QRS complex. Remember two things. First of all, the T wave runs away from the area of mischief, and the QRS complex is pulled towards the area of mischief. So, if somebody has got ischemia of the inferior wall of the heart, here I've got 2, 3, and AVF. Here I've got 2, 3, and AVF. So if somebody has got ischemia of the inferior wall of the heart, um, we look at leads 2, 3, and AVF. And with ischemia, you'll find an ECG pattern with ST segment depression. Sorry, with T wave inversion. So with T wave inversion, this means that there is ongoing ischemia. If there was infarction in the inferior leads, you would get an ST segment elevation. So ST segment would be elevated, and this means infarction. And this has to be present in all three leads, 2, 3, and AVF. If it was lateral wall, it will be 1 AVL V6. And if it was the right side, you'll have to look for lead AVR. The important thing is, if you get any changes in the inferior leads, you have to get reciprocal changes in the contralateral leads, in the opposite leads. The opposite leads to inferior leads are the lateral leads. And then we also have the interior leads, which is usually lead 1, V2, V3, V4. Then we've got the septal leads, V3 to V5. So these are the septal leads. So if somebody's got ischemia in lead 2, 3, and AVF, that means inferior one, and they've got T wave inversion, you have to have T wave upright in the opposite leads, in the contralateral leads. If you do not have contralateral features, then that means that this is not ischemia. Likewise, if somebody's got ST segment elevation in the inferior leads, you have to have ST segment depression in the contralateral leads. If you do not have ST segment depression in the contralateral leads, then that means there is no ongoing infarction, because there are different anomalies which are certain abnormal patterns of a normal ECG, in which you can get, for instance, a very common finding is the sagging of the ST segment, which is sometimes seen in left ventricular hypertrophy in hypertensive patients, and so the ST segment sags down like that. So this is not ischemia. The ST segment has to be above or below the baseline. If it's not above or below the baseline and it just sags from here, then that means this is not ongoing ischemia. So we have to look at the point of origin of the ST segment. So it has to either be above or below that. So as I said, I mean, there are different anomalies. For instance, if you've got global ischemia, you will see that there is T wave inversion in multiple leads, several leads, implying that there is global ischemia. If you've got infarction in more than one areas, you will get ST segment elevation in more than one areas. But then likewise, you will get some changes, reciprocal changes in the other leads, which are the contralateral leads. So this is how you can find out quickly, looking at an ECG, whether somebody's got ischemia or infarction. But as I said earlier on, remember, T wave is going to run away from the area of mischief. So it is going to run, if the inferior wall, T wave will run away, so it will be negative. If there is infarction, the ST segment will be sucked towards the area of mischief. So you will get ST segment elevation in those areas. Thank you.